Oh no, here we go again.
Oh no, now it says
Oh no, we. Okay. Whoo, we had a little scare. Had a little scare.
meeting is now in progress.
It's in progress. Okay, so we are live, Charles. We are live.
10-4, 10-4. Aloha no everyone. Good evening and welcome to Facebook Live with Mel and Charlie on this Saturday, the 5th of December. It's a beautiful weekend thus far, wherever you're at. I just hope and pray you had a great day today. The weekend is not over. We got one more day, and I hope the
Yeah.
weather treated you well in your neck of the woods. I know we got some people that tune in from as far as Texas. We still get our friends from other parts of the world that watch us. So we like to say aloha and welcome, welcome.
Aloha. Boy, you
Yeah,
know what? I gotta say one thing, Charlie. Lucky we live Kauai. And no offense to the other islands, just that, I get a little biased because I live here. I spent a couple years on Oahu, lived in Oahu, 1 year in Kailua, 1 year in Waipahu. But hey, tell Jonathan I said hello to Anthony. Thank you. Yeah, man, I just love this place. I love the people, and it's groovy, groovy, groovy. I was just telling Charlie before we went on live that we saw a bunch of pictures posted today from many of you that have gone out and supported local restaurants. And I got to tell you, last night's show was fun. We had, we got to meet human beings, local residents that are out there trying to keep their employees employed and provide a service or a product. And I just felt good last night, man. I felt good afterwards. I felt even better today when we saw the pictures, all you folks posting your pictures uh, of buying local. Gosh, I mean, it's just a great thing to see. And you know what? We can do that every day. We can do that every day. So, so cool, man. So cool. Patsy and I went to Leong's Meat House to get some poke bowls. Um, it was so good, Charlie. It was so good. Um, and healthy. But when we went there, we saw it's a family operation, right? So you see the mom, the the family members all working. Yeah, even the daughter, and it's just so cool, man. They all got their masks on, and they're just so nice and pleasant, so appreciative, so appreciative. But coming home, eating that poke bowl, and then seeing the other posts from many of you who went out and did it, let's just keep the run going, man. Let's just keep the run going. We're trying to figure out where we're going tomorrow. We know that we're not going to McDonald's, we're not going to Burger King, we're not going to Taco Bell, we're not going there no more. We're gonna focus, and that's why it's important. Share the pictures so we get to see places we may not be aware of, the food trucks especially, and we can go out and patronize. So yeah, it was cool, man. I felt good. I felt really, really good. Felt good.
I hope if anyone um, decides to um, surprise me with a run to Charhung Sut on Manakia Street and load up some, some pocash, manapua, rice cake, some pepeao, put them in a box and fly them over. I'll be so indebted to you.
Huh?
I'll be so indebted. Yeah.
That's just it. You can counter to counter, whatever that means. But I think we get that's one thing Kauai never did have one place like Chinatown. Yeah, Manapur, but he's talking about all the other stuff. The other things that when you go you can only get in Chinatown. I mean,
Hmm.
so I'm gonna have my wife take over. How's that? Okay, I'm gonna have her come sit down and do the show.
Well, it's the kind of stuff like when they come with a cart to your table, right? And then they tell you, oh, you like spare rib, and me, I just like sucking on knuckles. So when they get the chicken feet, the old style
Oh God. Yeah.
with the black beans, the 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 Chinese call it tau si, or the black beans inside the chicken feet. Oh, I love that. I can stay all day, right around the toenail, just keep on sucking away the cartilage. Whew. Man, oh man alive.
Wow. Wow. We went I was a council trip, and Ricky Watanabe, who was the county clerk at the time, or the deputy county clerk, and was up for a conference on Oahu, and we went to one Chinese. I mean, Ricky knows where all the hole in the wall places are. So we went to this one place, and he ordered the chicken feet, and I had basically told him that I would try. But then when they brought him to the table, I told him, "Brother, I pass." And he went to town with that thing. By the time he was pow, this is what I kind of figure out about chicken feet. When they bring the chicken feet in a small bowl,
Mhm.
it's about maybe three-quarter way full with the chicken feet.
Yeah.
When you pow eat the chicken feet, the knuckles or the bones
Yeah.
come past the level that the chicken feet was. That thing is all bone
Mhm.
or cartilage or whatever you call it.
Mhm.
There ain't nothing to eat in that thing. That is feet. It's a chicken's feet. Oh God.
Well, growing up, they always say, when you during those times, my mom would always tell me, especially when you're down by Vineyard Street, those areas and those humble times. I mean, if that's all you had to eat, they made the best of it, and that's what I miss. I miss those times. I miss those.
Yeah. Well, you know, I was far from rich. We were very, very I'm not gonna say we were poor because we weren't poor, but we were humbling times. I like how you say that. And my William, I love it, William. You might end up you might end up scratching with your feet or clucking. But we had like salmon gravy. We ate sardines. We had corned beef gravy, tuna gravy. We had all kind, and we had it often, but we never went hungry. We never went hungry, and those things I miss. Those things I miss dearly. Um, but the chicken feet, brother, that one I never had it, so I cannot miss it. I'm just thankful that my parents never make me eat chicken feet.
Well, somebody wrote that Chahong site has been closed since March or April, and that said, that's the backstory behind that. That's the Mao family, and the owner, the old man, was in the military with my dad, and he is the only one in the state of Hawaii that got a research license from the University of Hawaii in Waimanalo on their ranch. They have exotic animals they raise. They got zebras, but they got like some like mouflon, and they got rams. They get like four horns. That it's and he got what protects all the animals is these Rhodesian Ridgebacks, and you know how big those dogs are. And I remember one time going over there, just walking along the fence line, and had one puka in the fence, and a dog's head came out and almost caught me. But the the guy that you would always see behind the counter, Barry Mao, was a flight attendant for years for Aloha Airlines until they went under. Yeah, that was Charhung Suk. That's the backstory.
So we'll get to COVID in a little bit, but before that,
Mhm.
Jeannie just posted, "I make all that for your dinner." If you can message me the recipe, because I know Patsy can make them. The tuna gravy, the salmon gravy, the way the Portuguese make them.
Mhm.
Man, I tell you, it's it's delicious. It's delicious. No, 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 no. Patsy makes a good one, but the Portuguese style, I don't know how they made them back then. We never watched them cook, but good stuff. But anyway, that's sad that they shut down. And that's kind of a segue, I guess, into tonight's discussion because we keep hearing, Charlie, we for the last couple of weeks. Well, actually, we've since October 15th, we've been hearing from the lieutenant governor about how well we're doing, that how how good the unsafe travel program is working. And last night I had a call. Oh, by the way, today we had another triple digit, 133 cases, five more deaths in the state. So I posted, are you guys still say we're doing well? Well, we're not doing well. The unsafe travel program is not safe, and we're having a lot of issues. Um, but I got a call last night during our show. Actually, one of the senators from the COVID committee called me. I called them back after, trying to get them on the show, but asking if I had watched the Senate hearing, the last one, which was yesterday or the day before, the fourth was yesterday. And I said, no, I basically said, no, man, I don't watch that no more because it's just more of the same. And, we nothing happens. I see the action, and it's like being on a county council, the legislative body. You ask all the tough questions. You have no authority to direct the administration to change course. But what was surprising was that the senator was shocked to hear from the State Department of Health at the hearing that the state doesn't count the people that come in on that single test, but they don't get their results till after they arrive in Hawaii. And I'm talking, this is all, Kauai is different. So I'm not talking about Kauai right now. Kauai, nobody get the test, but prior to October 15th, we did. So those that came over did not have their results, and they got their results after they landed. That the state doesn't count those cases. Well, he asked me just like that. Did you know? I said, yeah, we know. We've known that from day one. We've known that from October 15th. We've known that from when our county, our mayor, Derek Kawakami, started counting the active cases, the cases that were active on our island, because the number of positives is meaningless if you don't know how many active people, people that have the virus. So if you notice, for those of you on the outer islands or the neighbor islands, if you notice, the Kauai report is not the same as the state's report, because we count every single positive, regardless of where you took the test. But the senator was shocked. And when they had discussed that, he said, and I didn't get a chance to watch it, but Libby Char said, yes, you are correct. And in fact, went as far as saying that the numbers that the state reports every day, is not accurate because of that. So that was in the Senate COVID committee hearing yesterday. But we have been saying this, Charlie, now since the beginning. We knew about that from the beginning because that's what we were told by our county, right? Our county said from the beginning, we are going to be reporting all the active cases, not just the ones that tested on Kauai. So I guess the solution or the moral of that story is they should watch this show. All these leaders and decision makers should watch this show if they want to get accurate information. See, we're not creating the accurate information, right? We're relaying the accurate information that's coming straight from our decision makers here. So I thought that was shocking, but it did light a fire again under the COVID committee, the Senate COVID committee. So I'm hoping that action is taken, and at least things will get done because of that. But can you imagine the State Department of Health telling the Senate COVID committee after 9 months of COVID here in Hawaii that our reporting is not accurate? It's like I don't get it. It's just not right. It is not right.
Well,
And then today we had the three Maui Elementary report anyway, that the three Maui Elementary schools are connected to a positive case because of a DOH employee that came out today as well. I guess it goes back to my original question, Charlie. Is it working? Is it is is the response to COVID-19 in Hawaii working right now? That's the question, Charles.
Well, I'll be honest. The way I feel right now, we've tried so hard. I mean, I got a good friend on Maui just wrote, and he asked me, he wished they would be more transparent when they have the major clusters, yeah, the reports, or where the breakouts are occurring. Because, they want to know just the location, if any. And based on what you're saying now, it seems quite evident that this government of ours, uh, it almost seems as if their subliminal message to us is, hey, we'll get to it when we get to it. And that's it. And no matter how hard you try to push, it's just like they turn you off. Well, one day, and I don't pray this on my worst enemy. Well, one day, if you should get bit by a loved one or a family member who dies because of this, then you know what everybody else is talking about. But you haven't reached that point yet. You know what I'm saying, right? They
Yeah.
haven't reached that point. They can always say, yeah, we heard about this, we heard about that. We're still trying to deal with, don't tell me that there's recoveries because people are still, they survived it. They haven't fully recovered from it. They're trying to navigate their way medically on getting themselves back in at least 80% of what they were, and they have a hard time with that. So, and then we're trying to prevent a mega surge from happening, but yet you don't give us the proper tools to fight this battle. You want to tell us about vaccines, you want to tell us about all kind of stuff, but we got so much pukas in the system. I'm just wondering, is it going to be a nightmare? Because look what happened with just mentioning the fact that, oh, we go from 14 days to 10 days, and you saw how the messaging was, right? So everybody assuming that we're gonna knock them down to 10 days. So they'd ask, oh, why the mayor sticking with the 14? Well, it's two different situations. But because of the messaging, it's so close to each other. Nobody from the state side is there to actually define what the heck was agreed upon and what they're talking about. And so it makes things really rough. And just to let the folks out there know, I did place a call for someone to give me the email address for the PIO for the state health department, Director Libby Char, because I understand we have to go through the PIO. So I want to send something to the PIO to get Dr. Char on this show and just be straight up. Our intent is not to back her in on corner, but I just wanted to tell us what's the real scoops, because everything else is sure coming out very, very conflicting. It's very conflicting.
Well, it was interesting. Dr. Libby Char was on the news. It was at the Senate COVID committee hearing, and they were asking her about the policies about a second test, about testing people after they arrive. And basically, what she said was it's a policy call. She cannot direct the governor or the lieutenant governor to do it. And it really falls on the governor, who has delegated the authority of the COVID response to the lieutenant governor. But the Department of Health supports a second mandatory second test after quarantine, after a quarantine, as does the CDC, as does every medical expert that we've ever heard from. And the question is, why isn't our governor, lieutenant governor, taking that advice or those recommendations and implementing something that will make it better? This whole nonsense of, again, shortening the 14 days to 10 days, uh, that is in situations where, and again, remember now, that is just for exposures, not for travel. It's apples and oranges. When you're talking about travel, when you're talking about post-arrival testing, it has nothing to do with you got exposed to a COVID positive person at work, or that's a that gets tracked separately. But the 14-day quarantine for travel, the CDC recommends that second test. And Libby Char is telling the Senate COVID committee, basically what she's saying is, you got to tell a governor, don't jump on my back. We give them recommendations. You saw the Department of Health's recommendations with Dr. Janet Berman when she wrote that op-ed in the Star Advertiser. That was the position of the Department of Health. And it was very clear that everyone was asking for a mandatory second test after a short quarantine, and yet the governor still rejected it. I don't understand. It is a policy call, and the legislative body, the legislature, cannot direct the governor to do anything. The Department of Health cannot direct the governor to do anything. So it really is in the governor's and the lieutenant governor's lap, and they have elected, rather than focus on the problem at hand, which is getting infected passengers on the islands. And that's why Derek did what he did. That's why he had no choice. But all the other islands now are going to be getting all the tourists that were coming to Kauai are now going to Big Island, Maui, or Honolulu. So the numbers are going to be seen there. But why are they spend more time talking about vaccination or the vaccine distribution, right? And they're all excited. We ordered 14,000 tests. We get 1.2 million people in the state. 14,000, you proud of that? We're gonna get a bunch of tests, but like you said the other night, Charlie, each patient gets 2 doses, so the number of tests cut in half. And then it's the front line workers, it's the elderly, it's all of the people that are vulnerable before it gets ready, before it gets out to the general public. So why not work on preventing the virus from coming here? Why are you guys so focused on? They have thrown all their eggs, Charlie, in the basket called vaccine, thinking that once we get the vaccines, we'll poke a few arms and the virus is going to go away. Absolutely not. If that was the case, we wouldn't have the cold, we wouldn't have influenza on the islands or in the state. The vaccine will definitely be helpful after a period of time. And right now, what we should be focusing on is preventing the virus from getting to our people. And that's what they have elected not to do. That's frustrating.
Well, there's some comments going on, and yes, there was a report on the news that the state is going to cut back on the contact tracers. Now here's where the problem lies, and I'm going to say it because I've been saying it from the early inception of this pandemic, and that is, we trace people who get infected, but they really cannot tell us unless they themselves who got infected say they didn't come in contact with anybody except they just came back from the mainland. Then they're going to say it's travel related, right? But when you got somebody over here and they came in with somebody who went to the mainland, but they don't actually know, that's the reason why we're trying to stop the virus from coming in, to give us a chance to just deal with what the hell we get in the state first. Let's clean that problem up first. But for some reason, this governor and lieutenant governor, they like to roll the dice, double down, and just say, "Yeah, we can handle both at one time." No, can. You can. It's not gonna work. I mean, I'm not a, I'm not an epidemiologist, but yet I sure as hell know that common sense can dictate, unless there's something so highly secretive that only the guys from the NSA know what the hell you're gonna be doing, and all us common folk will be left in the dark. But other than that, gee whiz, boy.
Well, Dr. Kim, we have Dr. Kim coming on. He'll be on the 15th, and we will have him on at gosh, was it 4 o'clock or 5 o'clock, Charlie? I sent you the email. I think it was 4 o'clock, 4 to 5. So we're going to be on early that night to accommodate Dr. Kim's schedule. We had 2 opportunities I mean, that's how busy this guy is. So we took the 15th, and I know it's a little ways away, but it's in 10 days. But we will get him on, and we will, and it'll be good because more. I think a lot of the vaccine will have been distributed to many of the locations, so we'll get some really good information on that. We talked. Someone was asking about herd immunity. I heard 60%, 70% of the population got to be vaccinated before. But we'll wait for Dr. Kim. He's the expert, and we'll have all those questions answered for you. I wanted to go back on the contact tracing. Now, while I was setting up for the show, I had a KHON2 alert come on my phone, and they give you like a little blurb, and then you got to click them, and then it takes you to their app. But it was about the contact tracing, and it said that, I swear it said that the contact tracers were only able to reach 43% of the parties. If you got that alert, and if you were able to get the story, let us know, please. I don't want to talk about it because I know what I read. It was just it was the teaser. It was just a teaser line. But one thing I do know is that the state is going to reduce the numbers of contact tracers, and I am concerned. I am flabbergasted, and I understand why. Because of money. They realized that at the end of December, there's no more CARES money, and that we would have to pick up the tab. Okay, and what? You've been using CARES money all this time. So the CARES monies that were used to fund operations that would have normally been funded by the county or the state. I hope you guys follow me. If they had let's just say they had $1 million in a line item for law enforcement overtime, whatever it was, but the CARES money was able to take care of that. What does that mean? That means that it freed up the $1 million that you had in that account. Now you could use it for post December 31st funding. So, but I see what they're doing. They're concerned. They're concerned that who's going to fund it. Well, we know the National Guard got extended till March, thank God. But the contact tracers are DOH employees or contractors from DOH, and the state gonna have to pick up the tab. So I think they're starting to reduce or do the reductions now. The problem is the same thing that happened back, when was that, in March, when we saw the 300 cases, when they had already lied to us about having 400 contact tracers when they had 15 or 18.
Oh no,
Then
no.
they had to go,
Yeah,
huh?
it was after. I think it was June when we had the
June,
big.
whenever was anyway, we're gonna be in the same position, guys. You cannot wait again. You cannot wait till the dam head broke before you go fix the dam. Right now, you got to make sure that reinforcements are there now. And yes, you know what? They may not be as busy now, but you know what? If you have more than you need, then let's do better contact tracing investigations. Utilize the people that you have to go deep into these people that test positive, and be ready for when the surge comes. Because look at what's going on in the mainland. When the surge comes, it doesn't come slowly. It comes hard and fast, and you better have your people in place. So the thought of reducing contact tracers is mind blowing for me, Charlie. It's mind blowing for me. I don't
Well,
get it.
I'm still wondering about contact tracing overall. I've never been a fan of. I mean, even when I was with the ME's office and we had to make notification next of kin, if we could go to the residence, we go. The only time we couldn't is if the next of kin was on another island or another state. But for the most part, if there was on island, we would go and track them down. That was our job. And what I'm seeing with the contact tracing now, I mean, you see them on the news, you see the girl, she's working hard, sitting behind a computer. But you tell me how many investigators have the luxuries of sitting in an office and trying to do the investigation from in the office? Most profession, when there's an investigator, they actually go out to the scene or they go out and do the investigation. I mean, I don't know if this is a numbers game or they're just trying to tap in on numbers because a lot of times if you ask someone a question on the phone and ask them in person, you get, I assure you, you're going to get relatively different answers. Okay. Because when you're talking into a device and you don't see a person's face, it's very easy just to answer off the cuff, right? But when
Mhm.
you got somebody looking at you, asking you a question, you think twice about what answer you're going to give. And I would think that'd be the best way. Now, some may say, yeah, but you don't can cover territory. Well, hey, that's the reason why you get all these contact traces and you send them out and you try flood the plains and if if you gonna contact maybe 100 something people, they might cross information telling you that hey, you know that this infection this spread we're working over here is actually related to your spread over there. But you don't know that if you're just talking over the phone. You won't know that. And I'm sorry. People can disagree, people can disagree with me all they want, but I've been down that path before.
Yeah. And I mean, even in my work now, because now what they're saying is, 40%, 45% or whatever of the people gave wrong numbers, Charlie. They gave wrong phone numbers. First of all, okay, I'll give them that. I'll give them that. You know how many cases we work in our office right now that the phone numbers are invalid because people change phone numbers, people give the officers phony numbers, but we have resources in our office that most investigation offices have, where you can go on a computer screen and you subscribe to a service and you punch in the vitals, and guess what? You get their current phone number. So when you if you and this is what I think is happening. You get this stack of papers, you call, burr, 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 I'm sorry, this number is not a working number, and then they toss it, they go to the next, rather than send that to maybe level 2 investigations, where guess what, those people, all they do is put this information in a computer, LexisNexis, whatever they use, and get valid phone numbers. It's
No, but
that important, I guess, Charlie, is what I'm trying to say.
you know how important it is that if you cannot get one number, you just don't file 13 that paperwork. And for those of you out there that don't know what a file 13 is, that's the rubbish can. You just don't file 13 that paperwork because that paperwork, even though you don't have a phone number, might be so crucial. That might be the one contact that can bust open one case wide open. You don't know. But if you don't try, you're only settling for second best. And if we say we are the best, then show it, man. Get off your collar and show it. Now I'm gonna get some contact traces that you don't know. Yeah, yeah, I don't know. But you know what? Your record speaks for itself. So you don't need to tell me what I know and I don't know. I just going to refer to your record. And I'm over here trying not to ding you guys. I'm trying to say how we can get this thing going in the right direction. That's why we always make the comment in the beginning. Hire retired cops and just let them take the program. And because look what happens now. It's no different what's happening right now. And that is, hey, we don't need the contact tracers. So what they're gonna do is start laying them off, right? It's no different. If as retired cops, we don't can make on debt, lay us off.
Hmm.
But when you sending out word that hey, we're gonna lay off the contact tracers because things are dying down. Oh, so that means that when firemen, right, when no enough fires reported, what you gonna let them off too? And then when a big fire happens, what you gonna do? Just let the building burn down? No. Whether you have on fire or not, you still get them on standby.
This is what I don't understand. Okay, how do you get into the system, right? Okay, so the one way is you come in, you do your Safe Travels app or your Unsafe Travels app. It's not even an app. It's a notepad,
Right.
and you put in your information now. I would assume, and again, this is horrible to assume, but that like on the federal ag or the Department of Ag form, it says that falsifying any information on that form is grounds for prosecution. Okay, so that number one. So everybody that comes through the line at the airport and they have this damn app or notepad or whatever it is, and they have the phone number there. Now, I see for me, inconvenience is irrelevant to the discussion. Inconveniencing a tourist to me is not even a factor. It's not because we're dealing with a deadly virus. So it's not like we're dealing with a mild thing or a traffic problem. No, we're dealing with a deadly virus, right? So everybody that comes through that line, whoever is screening, call the number. Call the number. If the guy's phone no ring, guess what? He lied. Prosecute him. Arrest him right there for falsifying a document. See, this is a virus, a deadly virus. Okay, so that's number one, right? You coming through. The second way is you, whatever you're a local resident or you are visitor, whatever, you get sick. You get sick. Charlie's laughing already. So you go
I
to the
get
doctor. You go to the doctor. Now, how many people you know, Charlie, when you go to the doctor, you give them the wrong phone number? How many? When you go to the doctor, Charlie, when you're sick, you're gonna see your personal doctor here on Kauai. You're gonna up there and they're gonna answer your phone number. You can put on phony phone number. How
no.
many people do that? Okay. Number two, right? That's the second gateway.
Yeah.
So contact tracer, you call and you get one wrong number. You get the form, right? You use Nexus, you get the real number, you go arrest them. The local person, call the doctor. Call the doctor. How hard? You see, these kind of things come second nature to us, Charlie. It just, I guess, because that's just what we do.
I'm
But
sorry. You know why I'm laughing? I
no, I
said,
don't. But
I said, booga booga, at the airport. When the people come through and they gotta fill out the info. You put one, like an old-fashioned electric chair with the hood.
yeah, yeah,
Okay, sit down. Okay,
yes,
what is your phone number? Tell me the truth now. And then and they go ask you, sir, why are you putting your hand on the button? Because if you lie, I'm gonna teach you a lesson, don't lie again.
that's right. That's exactly what I'm trying to say. But oh no, but if we do that, gonna take too long for a guy come through. I don't care. I really don't. Because how inconvenient is it, Charlie? How inconvenient, and I know you're still laughing, but and it's kind of serious, but
You
how
know,
inconvenient was it for you, Charlie,
yeah.
when you had to try get your brother all take his body? I just gonna be straight, man. How inconvenient. Did anybody give a shit about your convenience? When you called and said yeah, sorry, brother, your death certificate gonna be 6 weeks.
Mhm.
Did they worry about inconveniencing the resident who their loved one was in somebody's some refrigerated container in New York City because had so many bodies that they had to stack them in? Did anybody worry about the inconvenience of the family members?
Mhm.
So to tell me that inconvenience the visitor and it's going to tie up the airport, then you know what? Bring less flights, schedule them apart from each other so you can do it. This is not rocket science. And this is why I get so pissed off because all we hear is, oh, yes, vaccine. Oh, yes. Oh, yes. And in the meantime, we like make sure our visitors are having a good time in Hawaii. We don't like inconvenience them.
Let's
No,
let's
that
be
that would
prepared now.
not be good.
Let's be prepared for the vaccine because I can almost hear. They says, okay, we have good news and we have bad news. What's the good news? The Pfizer vaccine arrived. Okay, what's the bad news? Uh, the refrigerator was too warm. was it no 100 degrees below zero? Sorry.
No, you know, you know, you know, you know, you know what is not funny, Charlie, is that is probably going to happen. You know, it's like it's almost like a Saturday Night Live
No, you remember
parody.
you remember the movie Dumb Dumber when they
Yeah,
had the
Dumb and
cold
Dumber.
pole and the guy put his tongue against the pole and the pole was stuck. Go get one Looney Tune. He could be working. He could work the night shift. You know, the one that gotta check the temp. And he could say, hey, I like see how cold this bastard's there. He could put his tongue the next day the guy's coming. Hey Gerald, what you doing over there? Help me, my tongue's stuck. I sorry.
No, no, no. You know, I I don't know what to say. I the bottom line is that, and you know, folks, if if you disagree, go ahead and put them in the comments. You're not going to hurt my feelings. I know you're not going to hurt Charlie's feelings. But
Oh boy.
how many of you, and I mean this, and you know, how many of you, and you don't have to write it, you can use emojis to, but how many of you guys have faith and confidence in this state, in the leadership that we have? How many of you right now feel comfortable? And I'm not talking about your mayor, I'm talking about the state leadership because that's who's leading this thing. How many of you have are comfortable? Um, let's just say one is the least comfortable and five is that the most comfortable. Let's just use a scale of 1 to 5. 5 meaning that you're comfortable, you're very comfortable, and you have no concerns going forward. One is you have absolutely no confidence and that you fear of what's to come. Three is I'm okay with it. I'm curious. Zero. Somebody put zero. Marie. Marie. And I honestly want to get a gauge from you guys because zero, zero is bad. Zero is like, uh, I just want to know. I want to know. Two, see that's fair. One, thanks, thank you. One, yeah. I mean, I'm a one, obviously. Zero, one. Um, I don't. You know, I don't have confidence. I don't have confidence. And when we think that we might be heading in the right direction, the ones are coming. Yeah, don't stop. Keep on going. 1.5. Yeah, George. Thank you, George.
You know what somebody asked me, brother? I'm my head's still locked in on this 100-degree, kind of sub level, kind of real, kind of when you get those uh kind of liquid nitrogen, they say minus whatever degrees, right? That someone asked me, hey, uncle, so if the damn thing gonna be so cold, gonna be frozen, I go, I guess so. How they gonna inject that in your arm? I told him, I don't know, but gonna be sore.
Tell them no need the needle. No need the needle because the vaccine itself gonna be frozen. They're gonna just push them right into you. You're gonna be like on glass going in. No, I'm just kidding.
I don't know.
Um, Dana says, put me at minus 70 like the Pfizer vaccine. You know, um, Chucky says zero. And if I say more, I'll get kicked off of the show. That's how mad I am. Kento says -2, -1. You know, again, we try. And believe me, 4. All right, Cyrus. Good for you. Um, Me and Charlie, we talk a lot about what goes on during the day when he gets a call, I get a call. We share our information, we share our resources, we share whatever we talk about, and we actually try our best to understand and find a reason why they are doing what they're doing, and we can, and that and we talk to leaders, we talk to legislators, we talk to doctors, and I'm not talking about just on the show. We have pretty frank discussions with our own sources, and there is no rationale. There is no rationale. We talk about. When I was talking to the senator last night, I brought up the Dara O'Carroll report, and you can listen to Dara O'Carroll's report utilizing numbers that came from Kauai, which is accurate. There is no dispute. There is no dispute in this state that Kauai is reporting every single active case. It's the only county that's doing it. So taking those numbers, and there's also pretty good understanding or agreement that the numbers or the percentages for Kauai would more than likely work for the other counties as well, because we're getting tourists coming from the same place, flying on the same planes. Everything is pretty much the same. So the proportions would kind of be the same. So you can listen to Dara O'Carroll, his report, and explain to you based with Dr. Schwartz and all the other doctors that peer reviewed his data. And he can come out and say it could be anywhere from 7 to 15 times the amount that the lieutenant governor is saying. And this is why. Or you can listen to the lieutenant governor every single morning on KHON2 telling everybody that it's 1 in 1,000. 1 in 1,000 because I said so. Because that's what I've been told. Yes, because that's how it works. Because of the one pre-test 72 hours ahead, only 1 in 1,000. Okay, so you take that statement that's not backed up by any medical science, medical data or scientific data, but because it's coming out of an emergency room doctor's mouth who happens to be the lieutenant governor or vice versa, coming from a lieutenant governor who happens to be a doctor, or do you take the 7 to 15 times that from a doctor, a bunch of doctors that reviewed the data and the correct prevalence rates around the country to come out with that. Now, who in the heck do you believe? I mean, that's a no-brainer. And even after being informed of the report and the data, they choose to discredit the doctors. They chose to discredit the doctors rather than say, oops, new information, new data, new statistics, we might need to reconsider. No, they never happened. That never happened.
You know, it reminds me, and a lot of people have said this before, and this is the reason why Mel and I have said it over and over again. In this ball game with this virus, you got to go where the data is available, and you got to go with those who have tested the data and vetted. If the thing, it's like the trial runs on this vaccine. If it's unsafe, they're going to scrub the program. There's no ifs, ands, or buts, because they don't want to get people sick. That's just how it works. So when I hear certain information coming out by the LG, okay, that's fine. But I'm sure he got the data from someplace. And I'm sure he can explain how the data was derived to as how he's explaining it. Dr. O'Carroll, same thing. He writes, right? He writes a peer review, and he has other doctors read it so they can follow up the data and see whether what he said is true or not. And they validated it. That's the difference. That's the difference. So the information, when we bring on Dr. O'Carroll, Dr. Janet Berman, Lee Evan, Dr. Kapono Jong Hansen, it is data they've been working on, and the data that others have reviewed and said, yes, you're absolutely right. Or they might give an opinion, yes, except for this factor. But they're going to release that information to you, because what is our position with Mel and Charlie? We inform and educate, right? That's all we do. So we get these doctors who are knowledgeable in this, especially one who's been an advisor to a series on Netflix. Okay, it just wasn't a spoof that he did it, but he was an advisor to it. Because why? Because of the expertise behind it, and just like Dr. Berman. So now the question comes up. When they give that information, they did it in such a way that they broke it down for a layperson to understand. Because if they gave it in its raw form, like how it was printed on that piece of paper, I tell you, it'd be very confusing. We wouldn't understand what the numbers meant and all the different lines is crisscrossing, and that would not have made sense to anybody who saw it. But because of the way they explained it, I thought it was very well put together and professional. But again, that's me, Charlie Iona, as an outsider looking in. Hey, if I had to look at information, I look where I can get something in my hands, tangible, read it and understand it, and listen to the one who's giving out the info. That's the way I would make my call. Now, others may not seem that way, and I understand maybe you have a different methodology of how you would try to track down that information. But again, it hurts me to think that when you got these guys spending that much time coming on a show, repeatedly going on CNN, MSNBC, giving out information on a national scale and get criticized, okay, basically just short of being called stupid, I go, whoa. Now, hey, I think you better reevaluate before you say something like that. You got to reevaluate.
Well, we were all called stupid. We were
Mhm.
all. I mean, if the lieutenant governor said it right on his press conference or in an interview, he said
Mhm.
anyone that is spending their energy on focusing on the second mandatory second test. He didn't say it that way. He said everybody that is focusing on a mandatory second test is just stupid. You could do it the stupid way or you could do it the bright way. And yeah, so basically he did. He called everybody that was pushing for a second test stupid. They were spinning our wheels, and that is frustrating. Because there again, there is no dispute, Charlie. There is no dispute about the incubation of this virus, the period of time it takes, how this virus becomes contagious, how long it takes, how long it can take. There is no dispute. The facts don't change from the continent of the United States, from Korea, from China, from wherever, Europe, UK. The virus works the same everywhere. It's the same virus. And we know that there's that incubation period, that latency period. So we know that the single test is insufficient. That just it is. Yes, we're going to narrow them down very little, but again, the lieutenant governor's focus was being able to take care of sick patients. That, in fact, if we had a surge, we had the capacity in our hospitals to take care of them. And that is where the disconnect is between Dr. O'Carroll and his team versus the lieutenant governor and his team. The doctors are saying, let's not do that. Let's not get our hospitals up to a capacity. Let's take care and let's prevent the virus from coming in. And that's really the difference in opinion between the two sides. And I just don't know anyone who supports the side of the government that, let them come, we'll get some, we'll treat them, some will die, but we'll do the best we can. That's not how it works. Real quick, Charlie, I want to Tracy, who did see the KHON story, said KHON basically mentioned that in October alone, nearly 600 close contacts didn't respond or could not be reached. It just reiterated that they are not getting in touch with the close contacts of these positive patients. And then Nick also saw it and said they're also taking too long to contact them. Some people get notified 10 days later. So this is all a recipe for disaster. When you're not preventing the virus from coming in, and you not doing the proper. Remember when we all started this crusade? I guess it was all about the testing and the contact tracing. Remember how everyone was on the Department of
That's the
Health?
only thing
Gosh,
that was available to fight to kind of level out the playing field, right? At the time.
right. I mean, and we knew that that was critical. We knew that that was the two components that we needed, regardless of what way we were heading. That was that were the two things that we had to do. I mean,
Yes.
Anderson lost his job because of it. What's that, Wahini? Dr. Park, she got whatever. I don't know. She's on leave, I think, with pay or whatever. But because they couldn't they couldn't come out and do what they should have done with contact tracing. uh, they failed, and yet now contact tracing is still not working. Testing sure as hell ain't working because we're not going down that road. Yeah, every so often they'll pop up a surveillance test. It's like Caldwell will do it. If you get extra tests, you'll do it. But there's no concerted effort on the state's part to run an effective testing program and an effective contact tracing program. And it's clear. And again, going back to what I said earlier, those people that not answering the phone or not, come on, man. I mean, so does it stop there? Are you ever who's in charge of contact tracing? Are you guys satisfied with that kind of performance? If your house got burglarized and the suspect and the officers just told you, sorry, we cannot find him. Case
You know,
closed because we just cannot find him.
well, look at a burglary case, right? A lot of times the investigator has to go out because they'll follow a lead right to the pawn shop. They don't just call by phone and ask the guy, "Hey, you get one ring over there?" The guy going, "Yeah, yeah, I get like 800 different rings. Gotta be on specific ring." And he go to the pawn shop. That's what you call a good investigator following up. And
Yeah.
I think you remember when the Pacific Tsunami Center says that there's a tsunami coming in, right? The dark buoy, where they tell us where the buoy is located, it gives an indication that one swell is coming in because there's activity, right? So they let the people know. What do we do as a society, especially and as a close knit community here on island? Okay, we go out get provisions. We go out start getting gas for our generators, right? In case anything happens, we make sure that we get more than enough. So in case we got to help others, we even go as far, especially if we work down in places like high traffic, tourist related areas. We go there and advise the tourists, hey, something bad might happen today. Best you go highlands for now and wait this thing out, right? Nobody is left behind. The point I'm trying to make is with this virus, because everything is so hush hush, when you get one breakout, nobody like tell you where the breakout's there. We get so many hands on deck, but everybody's like on standstill. We're like, hey, we like help, but nobody telling us nothing. To me, that's why I think the state is falling. So they worry about this HIPAA. This, you know what? If people dying, folks, so it's to a point. You like prevent that. You get all hands on deck. Everybody do the job. And furthermore, if you watch today's news, okay, they asked one medical director. He says they're waiting for that Thanksgiving surge, but right now their hospital is at 125%. That means they got people in the hallways. Some critical care patients, they cannot send them to another hospital because that hospital is already taken up. They're talking about this was done in El Paso. So my question is this: what do we do? And the only thing I agree with Caldwell, he said it. He said it very plainly, and I said, okay, I appreciate what he said. He said that there is no way you can put a patient in one car or an ambulance and drive them over to the next county.
That's right.
Doesn't work that way. We don't have that. We don't have that luxury here in Hawaii. We don't.
That's what sets us apart from the mainland. That's why it's so different over here, and that's why it should be more concerning because we don't have that luxury.
Yep.
And as the cases spike and on the mainland and more people getting sick and more people are dying, we have that period before it gets here to prepare for it. Like you talk about the tsunami, we have an opportunity when that buoys, like you said, when that sea level, whatever the surge or whatever it's called, it monitors. They can tell you when it's far away, so you can prepare. We have no reason not to be prepared because we've had 9 months and we've had enough people from different countries and different states that have been somewhat successful. And it all they all have the same common denominator, right? It's always locking down, keeping the virus out. If we kept the virus out of Hawaii, we could we could be a normal state. We could move around freely and really keep our economy flowing. But because we never did that, um, now we're in a bind, and it's almost like we got nowhere to go now. We just got to wait and see what happens. What scares me is we have uh, Thanksgiving that just happened. We have Christmas coming up. We have New Year's. New Year's in Hawaii, man. There ain't no way you're gonna keep people apart. Uh, it's just not gonna happen, and and we'll see the residual effects from that. Probably a month after that, and then by then it's a little too late. By then it's a little too late. Yeah, over the since the pandemic, we got to meet a lot of people virtually, like online, and Patsy and I was listening to one of our new friends because of the internet, and he had just gotten COVID. He was off the air. He does some live streaming as well, and he was offline for a while, and he finally told us yesterday that he get COVID, and he was online today, but you could hear him coughing. You could hear him. He's not well. He's well enough to do a stream, but he's not well. And I think, wow, he was a young guy. He's a young guy, and that's what's happening. A lot of these guys are contracting this thing. He's on the mainland. He's on the East Coast, but nonetheless, this thing is it doesn't stop, man. It keeps going and going and going, and we're hearing the horror stories now. We're hearing. I know you, Charlie. You probably get them just like I do. The calls or the messages,
Yep.
and people unfortunately cannot speak up uh, for various reasons, and they rely on us to get the message to the right people, and then we try our best. But people not following the rules. People are not going to follow the rules. I think the vast majority will, but you still get those people that are not. And
Well, I trying to find out, and I'm going to ask you this question now. You know, the people of Hawaii, they're Akamai people. There's no doubt about it. But I'm just curious because everyone that wants to come from Hawaii are all in danger areas. I mean, they're either shutting down or they're having advisories, no travel. Their case counts is skyrocketing, and they want to come to Hawaii. I just want to know what makes us so unique in a sense that yeah, we'll let them come here and nothing gonna happen to us. I mean, that's what the attitude seems like, and I'm like, wow. I mean, if that's the case, it's like a it's like a terrorist, yeah. You know, this person is on a no-fly list, and he lands in Hawaii, and they got a picture of him. They got a picture of him, and nobody, and because he's spending money here and enjoying himself, nobody wants to turn him in. I mean, maybe that's an extreme example, but I'm still trying to figure out. I mean, it's a toss up, right? You coming from California, you may or may not be infected, but it's just that their numbers are high. What do you do? What would you do? How would you handle that? Or they come from Florida, the third now highest infected rates, cases, and they come to Hawaii. How would you handle that? I mean, you cannot discriminate against them, I understand. But how do you handle them coming in knowing that they're coming in a highly infected area? Highly infected area.
quarantine. I mean, that's all we can do. Given the hand that we've been dealt, that's all you can do. The thing is, and again, this is where I struggle. When you're dealing with a virus like COVID, when you're dealing with the how dangerous this thing is, that I don't know how you can have a discussion with uh, inconveniencing the tourists as part of that discussion. No, you handle the virus first. And if people still want to come and they decide to come, we always said from the beginning, Charlie, quarantine hotel, quarantine facility. Not you go on your own self quarantine, no, quarantine facility. And you we said this from the beginning. The CARES money could subsidize. You will pay. The tourists will pay for their quarantine. But if the hotel is willing to open up and uh, the tourists would pay, but yet you want to make sure that your employees are safe, and you would make sure that the testing protocols are all in place. But that is the only way, is to make sure that they are locked down for 14 days. Now, if the tourist numbers drop, and remember when we had the 14-day quarantine, the visitors were still coming. Yeah, not in the large amounts. When we added the second test option, or the first test, the one test option, more people, a lot of people came. Uh, and then the numbers started to rise, right? The numbers started to bump again. So we know the cause and effect relationship of travel. We know it's nothing to dispute. But what you're talking about is, what would we do? What could we do? Is you got to quarantine, make sure that they're in quarantine. And the only way you can do that is by having them in a quarantine facility or several quarantine hotels that was properly supervised. And yes, they pay for it. And that's the only. And I'm not talking about the quarantine place that they took the retired police officer. I'm not talking about that. I'm talking about allowing the hotels to operate, um, but having the meals dropped off at the doors so that the employees could still have a job. They're responsible for their own laundry. I mean, you're not doing the daily turnovers on the rooms. I mean, things like that. But getting them in a facility where they could not leave, because inconveniencing the tourists again should not be in that discussion. That's just not going to be in the discussion. But going back to what you originally said about, I I couldn't understand. I still cannot understand why they think we are different. You mentioned that, right? That why we, the governor guys, think that we are going to be different from California or Florida. That the virus is going to be different when it gets here. That more people not going to get sick. That we'll be okay. That we have enough hospital beds. That's the part I don't get. We are not different. This virus, every place this virus has gone to, has created devastation. So it's not that it's going to come here and, the salt air or the hot temperatures going to kill the virus. That's simply not the case. Simply not the case.
Well, let me ask you this simple thing, and I just being simple-minded about this. And correct me if I'm wrong. And the people out there, a lot of you are chiming in right now. Please put it online. Let Uncle Charlie know if I'm stepping out of bounds when I say this. I'm just trying to wonder, why are we still having cases? Every day we get cases. If we're so different, we shouldn't be having cases. We should be under 10. But we're not even anywhere near that. And I'm talking about Oahu. It's almost predictable because they're 2 days behind, that when we reach a certain point in the week, the number's going to drop down because it covers for the weekend. You come out of the weekend, we're going to be low, maybe Monday, Tuesday, because we're talking about Saturday, Sunday. But boom, when Wednesday comes, whoop, it's like a no-brainer. It's like Family Feud, but we know all the answers already. Or Jeopardy, right? We know where the answers stay. I just want to know, how can we still get cases? I mean, I want to ask the governor. I want to ask the lieutenant governor. You're 1 in 1,000. Okay, fine. But why is Oahu still above 50? Why? I mean, there's got to be something adding on to something, or what? Unless somebody's calculator broke and stuck on numbers, and bugger repeating itself so much that you're getting high numbers. But I just want to know, why do we have cases? We shouldn't. If they're that sure of themselves that we are so different, then okay, why do we have cases?
Yeah. I'll never forget the question. Was it you had asked him, Charlie? I think it was you had asked the lieutenant governor right here on the show. What was the threshold?
What's that trigger? What
What's
would?
the trigger?
Yeah.
And he said 7 per 100,000.
So that's
7 per 100,000 of population. When we get to that, we shut him back down.
that's 70 for
That
Honolulu.
is 70 for Oahu.
And guess what?
100, what today? 100, 133 today. Well, that was in the state. I don't know what Honolulu was, but
28 for Big Island and Maui, and it was 100 something for Honolulu.
yeah, yeah. And Caldwell still talks about his tears. We can do it, people. We can do it. No, man, you guys, it's not doesn't work that way. It doesn't work that way, and I worry where this thing is going. You know, I worry where this thing is going. Kawhi, we had one more case today. Local resident, travel related. People, relax, stay home. Stay home. There'll be time for travel. There'll be time to travel. Spend time at home. Spend time with your families until this thing passes.
Yeah.
Because sometimes, Charlie, I think about this, like, and yes, the vaccine brings promise, but I am a realist. I am a realist, and the world is competing for those vaccinations.
Yeah.
And we're already talking about getting a very small percentage of the stock, but the problem is if it's going to take we're going to have to get all that doses out, and vast majority of people got to take them. That's going to be an issue. So while that is there and the light is at the end of the tunnel, the fact remains that there goes Charlie again. The fact remains that we gotta hunker down until then, and it might be a year. It might be a year before we even see the dent from the vaccines.
You remember growing up as a kid, the neighborhood, we get the ice cream truck, the thing play the music.
Mm-hmm.
When the vaccine comes, the one you got to be 100 degrees, negative 100 degrees. Come an ice cream truck coming around, letting you know the vaccine coming. But the thing I'm going to ask you is this: you got three companies, right? You got Pfizer, you got Moderna, and you got AstraZeneca, right? Why is it that Pfizer requires such deep freeze and the other two don't?
Two different types of vaccines. I think that'd be the first question I think we'll ask Dr. Kim.
Mm-hmm.
Like, and what happens, Charlie? What happens if they give you the vaccine,
mm-hmm.
and the temperature wasn't maintained? What if somewhere in that airplane or however the heck they're gonna get them here,
or
what if it loses what happens? How do you know if the damn thing is even still good?
Or what if you take the first one, they run out, and you schedule to take the second one, and they tell you, hey, you got to go to the room temperature one. Then what you going to do? I think by fear alone, the day before you take the room temperature one, you can put yourself in a freezer, say, maybe I go freeze myself. Then maybe when you inject them in me, I can bring them down where it's supposed to be. I mean,
yeah, I know I did hear on one of the news channels that these are not interchangeable. So yeah, you stuck, bro. You're gonna deep freeze your body. I'm not sure how they're gonna do them.
And I know I'm making fun, but because somebody said, "Oh, when Uncle Charlie laughing because I pissed off," I said, "Well, you may be right, but go and get one low security, go and stay overnight, watch that freezer, and he forget he went put his his Haagen-Dazs bar in there, and he forget him the next day, And they do a big press conference rolling out a vaccine. All the cameras over there taking picture. They open the door. Boom, all this ice cream fall off.
Oh boy. Uh, what
Can
you
you?
guys doing tomorrow, Charlie? What you guys doing tomorrow, Charlie? Sunday. Tomorrow is Sunday, man.
Well, tomorrow we give thanks to the Lord because this year makes my 8th year that I was given new life after my open heart surgery. So I'm thankful every single day. I'm just thankful. I'm thankful that my family is safe. I'm thankful for you and Patsy, you're safe, and all of our friends here on Facebook Live that you're all safe. That's what I pray for. There's times I've never found myself going into deep meditation. I was never the type of person going to really, really deep meditation. Stephanie calls it that I'm just lazy and I'm sleeping. But I told her, no, honey, it's deep meditation. I'm meditating.
Oh
That's,
boy.
that's what I'm gonna do.
Right on. Awesome, awesome.
Take,
We're doing some general cleaning around the house. So it was actually we did a lot today, and we'll finish up tomorrow, which is kind of out of my element.
Heavy labor.
Yeah, we actually was able to build some shelving units together today, which is the first time that has ever happened. But yeah, it's good, and tomorrow we'll finish up and NFL football tomorrow. Of course, Patsy finds time to bake her. Did you see that stuff she made, Charlie? I post them on Facebook.
was that an Oreo parfait?
Brother, somebody had asked, what is that? In fact, the guy with no, not a friend from the mainland. I said, I don't know.
Yeah.
I have no idea what it is. I have no clue. I know it's an Oreo cookie, but what's in that cup? I don't know. I
That,
don't know.
that
I
is.
think it could be blended chicken feet. I'm not sure.
Ooh.
Yeah, it was yeah, I stay away from those things, but I see them. It looks so damn delicious, boy. Damn.
Well, for
But
dinner,
All gone.
I did today because in the ice box had one cup, Charlie, with Oreo cookies. Was just the cookies. Never had that other fancy. Was just the cookies. And I never eat one Oreo cookie for so long, and was in the ice box, so it was cold, Charlie.
yeah.
You get Oreo cookie. You eat Oreo cookies.
Well, I eat the new one that just came out. It's called short change. You ever tried those?
Is that the thin ones?
No, short change is when you break them open, no more the filling inside, just the tube. Just the, they short change you. That's what they call
No,
it.
but this one here, Charlie. If all of you, if you eat Oreo cookies, put them in an ice box. Put them in an ice box, because I tell you, it's a whole different experience when it's cold and crunchy. Anyway, so I had one, two, three of them. Three of them. So
Well,
tomorrow it's a 7 mile day for me. 7 miles. Tomorrow I'm gonna drive 7 miles instead of the 5 mile drive I usually do in the morning. Anyway.
Nick Lewis said, put your Snickers in the freezer. Well, I did that, and guess what? My front two teeth went fall out. So no. I just like to say thank you, brother. Again, we got to keep a close eye on what's going, because again, there's so much conflicting messaging coming from the state, and if we can get some kind of clarity and let the people know. So, because I just don't like nobody be in fear with the wrong messaging. That's all.
That's
I just
it. So on we get on deck, we get Dr. DeWorkin, we get Dr. Kim on the 15th, we got Minnie Cole. We'll be lining them up for next week. And try to get this. Huh?
Pausina.
Oh no, he's Monday.
Yeah, that's what I said.
Yeah, Monday. Sorry. Yeah.
Then Tuesday, I'm gonna try to get Jimmy Chan from Kimchi 2, Island of Oahu. Let him come on and let him talk about all the meals he's been giving away. despite having a hard time himself with his business, but he's doing it. He's doing it. And they get the old-fashioned style Kobe, the one they take the big rib bone and they butterfly them open, they roll them out. So by the time it open, the bone end up on one end and all the meat. Yeah, that's how.
Oh, yeah, I like that. Yeah, it'll be fun.
Yeah.
All right. Well,
Okay.
Roger Dodger, man. Thank you, Charlie. It's always a pleasure. I'm
Same here,
sure
brother.
we'll chat tomorrow.
Yep.
Everybody will be off tomorrow night. We'll be back Monday night with Paul Zena and forgot her name. Sorry, but
Deep fried Oreos. You saw that?
I know what Marina. Was it Marina? Oh yeah. Anyway, we'll be talking about the DOE and what the DOE and the medical staff, what they're doing to keep the classroom safe and trying to get the kids all back in school. So we'll have them on Monday, and then we'll see you guys then. As
Brother,
always, thank you guys. Go
brother,
ahead.
brother Tommy Silva just sent you and I a picture of some deep fried Oreos.
Oh, oh,
Deep fried Oreos.
oh my God.
It's a one scoop of Haagen-Dazs ice cream, vanilla ice cream. Yes.
Oh, oh well. You know what? Can you do that?
Deep fried tofu.
I'm getting deep fried tofu.
Well, I'll pray for you, brother.
All right. Okay, we'll see you guys Monday night, everybody. Monday night, 7 o'clock. Dr. Zena. I mean, not Dr. Zena. Paul Zena. I forget her name. Marina. I think it was Marina. Oh yeah. She's a nurse, registered nurse. We'll
Yep.
see you guys Monday night. Love you guys.